I think one thing to remember while we're pregnant is pleasure can be, oh my gosh, you did the dishes. Pleasure can be a picnic and reminiscing. The purpose of pleasure in pregnancy for me as an educator is what I want you to go for pleasure is because the oxytocin is what's governing your labor. The melatonin, your circadian rhythms, like all those hormones are what is getting your body prepped and ready for labor and it's actually starting labor. So if you're in fight or flight and angry and stressed out and all of those things all the time, you're postponing what could be a moving forward train, right? Welcome to the Birth Education Center podcast, hosted by myself, Care Messer, an entrepreneur, birth educator, and doula. My team and I want to help you discover your options in birth and postpartum, how to find your voice, and how to use that voice to navigate our maternal healthcare system. You and your baby are not just a number. This information includes doulas too. Now let's get started. Welcome back to our February lineup. I'm excited for our guest today. I get to introduce you to Lauren. Dr. Lauren is the founder of Thrive Physical Therapy here in San Diego. When she first moved to San Diego, or did you move back or did you just move here?
I moved back.
You moved back, and I had the center open in Scripps Ranch, and first thing she did was, "Hi, can I come to birth class?" And I was like, "Hi, you're really flat. You're not pregnant."
Yep.
And
That
she's
was
like,
me.
"I know, I wanna learn everything about because I'm working with pregnant women, blah, blah, blah." And that's how we met, and she took the whole hypnobirthing series, and she showed up every week, and she took tons of notes, and then I started referring her to my moms, and they loved her, and then it has blossomed over the last 12 years. So
History.
yeah, I'm excited for you guys to meet her. She's phenomenal. She specializes in perinatal pelvic floor. She founded her company with her husband, who's beautiful, by the way.
Just yeah, a little
Yeah,
bit.
he's pretty. He's pretty. And he's smart and he's
Mhm.
functional and educated
Yeah.
and
He
so
has
good at what
all
he does, but he's really pretty.
also very pretty. Yes,
Also
yes.
very pretty.
Great
Uh,
bicep.
yes, and she's also a trained postpartum doula. She delved in with everything so that she could learn all sides of her business, and she just had a baby last year who
Yeah.
is also very pretty. He's gorgeous.
He's gorgeous. Everyone thinks he's a girl 'cause he has almost a full ponytail now. Like,
Oh my
it's almost
gosh.
all in there.
Yeah, he's gorgeous. He's
Thank
gorgeous.
you.
So today we're going to talk about connecting to yourself, your body, understanding your pelvic floor. We do not get enough education through high school, junior high, college, just in our life in general, right? And then now we're going to be using it during pregnancy and postpartum in a way that we have never used it before. And we want to get it healthy before, during, and after, but we need to understand and connect with what that is. So we're also going to talk a little bit about pleasure and what it means to understand your pelvic floor and how to protect it, how to push with it, all those things. So,
Yes.
um, thank you so much for being here today.
Thanks for having me. I always tell people that you're my first in to, like, the birth world side of what I did because I was a pelvic floor physical therapist, but, like, that's just, like, the nuts and bolts of it, right? Not the, like, "Oh, it actually happened." So, thank you for inviting me to the whole series of the hypnobirthing class. I thought I was just gonna show up for a little bit and learn, and I was like, "Oh, okay, so these are, like, 4-hour classes for, like,
Yeah, you didn't understand.
how
Hi,
long
it's
is it?"
actually a college course for 5 weeks, and you're expected to show up to all of it. I don't
After
remember
work
if I was kind of militant about that, or maybe I was. Maybe I was. So anyway, you did show up every week, and you
it was
took
great.
notes.
I just sat and took notes and watched people, do nipple stimulation. It was
Yep.
fantastic.
And
I
I think the nice part about anyone outside of birth coming in to take a birth class when you're going to be working with parents is you hear their fears, you see what they're up against, you see how their mind's going, what they're feeling. They have no clue in a lot of things, and then they're really strong in like whatever education they bring in as far as their occupations and stuff like that.
Mhm.
And when they can combine that and also be in a group setting, it's phenomenal. And especially if you're going to be working with parents in any form, taking childbirth ed from all the different teachers in your area, you're going to learn a lot and have a different sense of a way to connect with the families that you're serving. I think one thing to remember while we're pregnant is pleasure can be, oh my gosh, you did the dishes. Pleasure can be a picnic and reminiscing. The purpose of pleasure in pregnancy for me as an educator is what I want you to go for pleasure is because the oxytocin is what's governing your labor. the melatonin, your circadian rhythms, like all those hormones are what is getting your body prepped and ready for labor, and it's actually starting labor. So if you're in fight or flight and angry and stressed out and all of those things all the time, you're postponing what could be a moving forward train, right?
Yeah, it was amazing, and never having been pregnant too was, like, that was huge to be able to still I'm not, like, living a pregnant person's life, but see it, like, instead of them
Yeah,
just
but now you have lived a pregnant person's life,
I know.
so which wasn't at that time.
Yeah.
Yeah,
Yep.
so good. So I would like you to just kind of since in America we don't know anything.
Mhm.
What is pelvic floor therapy? What does that look like and why do we need it? How is it paid for? All that kind of stuff.
Awesome, okay. So, first of all, I always skip over this part, so I'm so happy I just remembered to do it. It's not even on my notes. This is the pelvic floor. So we talk about pelvic floor physical therapy. Maybe we should first talk about what the pelvic floor is, right? And stop me care. I go, go, go. So stop me if it gets too
Well,
much.
and it's nice that if people are watching on YouTube, they actually get the visual because a lot of times with podcasts, if they don't do video, you don't get to see it. And my pelvis in class doesn't have the
And have
muscles
some
that
muscles and stuff.
Lauren's has. So yeah,
I also just realized my cute, my sparkly stool that I've had forever, it's like squeaky. So if that's annoying, it's also
it is what it is.
good.
I'm
Okay.
annoying, so it's fine.
So here's your pelvis. If I'm standing up, pelvis. Okay. This is the top of your pelvis. This is the pubic bone. These are your like sit bones. Okay. If I flip it over and backwards, here's the tailbone, sacrum, spine. Push ups for life. That's just our PT signed it. We can talk about that later. So your pelvis holds all of your organs, including your uterus. This is the uterus with the vaginal canal attached. So this is where the baby is living, right? There's also the bladder, and then the poop chute. Okay. All of that stuff just so you can see. Woo! Sorry, Muff. My dog's back here. Oh, her name is Muff, like the pubic hair. Um, this is how it's all fitting together. So facing forward like this, the bladder right underneath the uterus, in front of the vaginal canal, and then
Which
right.
is why as baby grows, the bladder gets squished and squished,
Yeah,
right?
see that picture there too. Shows that stuff. Swished and squished exactly. So here's the pelvic bowl, or you'll hear pelvic floor, but it's more shaped like a bowl. This like first layer, like looks like a triangle, is responsible for closing. And then deep down in here, the bowl part is responsible for lifting. So if you've heard of doing kegels, which we call them push-ups here, you close and lift. These are the muscles that do it. Also the muscles that you can like stop the flow of urine, or if you had like a tampon in, if you're thinking of pulling up, like closing around the tampon and then pulling it up, those muscles. Okay. So they are muscles just like every other muscle in your body. It is important for them to be strong, but it is also equally important for them to be flexible and functional and mobile. And in terms of birthing vaginally, you definitely want these to be more mobile than tight. And we'll get to that later. If you don't listen to the rest of this, tight does not equal strong. We want mobile pelvic floors, not tight pussies. Okay, you can skip, I guess, the rest if you want. Um,
I do have
so,
a question on your model. What is the blue
oh, you would.
side?
You would. Carrier jumping.
Sorry. Okay, don't do
No,
it.
no, it's okay. These both blue parts are part of the clitoris. So the whole clitoris actually looks like this. So if this was in
Since I only
the
saw one side, that's what I was like, are those
yeah,
the
yeah, yeah,
lobes?
because they're
Okay.
only taking out like bits
Yeah.
and pieces of the muscle. So here's the little like head piece that most people, or hopefully most people, know about.
Clitoris is a lot bigger than you think it is, and it's
Yeah,
really
that's
important to know it's a bigger organ.
so it's here, and it actually straddles the vaginal. Oh, this one doesn't open, but it doesn't. It straddles the vaginal canal. Okay. These holes here, that's the pee hole, the vagina hole, butthole. Right. So you can see how this straddles the vaginal canal. So I think we'll talk about that more later on how great the clitoris is in that it's not just one little beep button. It's a
And
whole
one
thing.
reason we want to avoid episiotomies if we can, because they can
Yep.
go right through that lobe, which can affect orgasm.
Mm-hmm. It's
But
just and just you just don't need to, like, if you're gonna tear. Like, the skin there at the bottom is, like, really thin. I mean, you can tear wherever, right? But it's really common to tear here. It's really thin there, and it's, like, meant to do that. And then anyway, I'm getting off
and then it
topic.
can repair itself.
It
Like,
can
you can
repair,
do that.
and they can stitch it too, right? Which is not a huge deal if they have to stitch it. That's helpful. So you don't have to wait for it to go on its own, but it can, okay?
Yeah. Good pelvic floor assessment, everyone.
Pelvic floor. So, as a pelvic floor physical therapist, occupational therapists also work with pelvic floor. Pelvic floor physical therapy is working on these muscles, or at least working with these muscles in mind. So, I have patients that come to me that so I do like internal pelvic floor assessments, right? Where we're doing one finger glove lube internally. We'll talk more about this too. So I'm getting ahead. Um, but we can do sessions without anything internal vaginally into the pelvic floor directly because your pelvic floor is affected by and affects the rest of your body all as one cohesive unit that your body is. Your pelvic floor is part of your core, so it's a one of the big reasons I got into pelvic floor physical therapy was like in PT school, we had like one, no, we had two 3 hour like classes on pelvic floor physical therapy. And they were like, okay, do a Kegel. And like most of my class couldn't do it. I was like, oh no, weird. And these are all, we're about to be PTs.
We're all professionals here. What the heck?
Yeah. So anyway, it is part of your core, and so if you're having any, like, back or hip or any issues like that, your pelvic floor can be a part of it too. So, pelvic floor physical therapy is for everyone, not just people who are leaking. Because if you've heard pelvic floor physical therapy, you'll hear it related a lot to, like, urinary incontinence, fecal incontinence, prolapse, where the organs that live in there become a little bit lower, um,
Well, and
pain
we're
with
I was gonna
the
say we're always talking about it, what we'll how we'll need you at the end, afterwards, when everything
afterwards.
is wrecked, right? And one
Yeah,
of the things that if I get a person early in their pregnancy, I'm like, "Have you been to a pelvic floor therapist yet? Like, go get assessed." And they're like, "Why
yeah.
would I need to?" And I'm like, "Oh,
Oh, yeah, yeah,
there's
yeah.
so much that you need to know about your pelvic floor because if
Yes.
it's tight on one side, you can work on stretching and opening that. If it's I mean, there's so many things to know. What if you had an injury on your tailbone and from cheer in high school and it's affecting your pelvic floor now? You're getting ready to push a baby out. It'd be
Oh,
helpful to know which side is weaker or stronger to know the best way to do that. So, yeah, we'd
yes.
always think of it as something we do afterwards for repair, prevention. Come on, everyone,
Prevention,
prevention.
yeah, prevention and preparation, right? Like I was talking about your pelvic floor needing to be able to relax and stretch if there's going to be a vaginal delivery. Also, if you're just carrying a baby, your pelvic floor is carrying it, so it does have to stretch some. So for everyone, in specific on what like we're talking about, when you're pregnant, the types of things that we're working on is just exactly like Kara said, to see if there are any inequalities, if it's tight on one side or not really functioning very well on the other side, or maybe the way you're walking, you're squeezing your pelvic floor really tight, and then you're just walking around the world with this really tight pelvic floor
And you're not even aware of it.
and you're not aware of it. And sometimes tight pelvic floors, oftentimes tight pelvic floors can be the causes of urinary incontinence, which I know people don't think, can be the causes of painful penetration, can be the causes of like feeling like you have to go to the bathroom all the time. Yeah, okay, if you're pregnant, you're probably going to the bathroom often because you're drinking more water and you got a baby sitting on top of your bladder. But if it's not that, and it's like earlier pregnancy and it's not just the weight, it could be that your pelvic floor is really tight, and so we can help to like get rid of some of those issues that you don't have to just deal with. I feel like there's a lot of that too, like, oh, you're pregnant, like that's just how it goes. Or you just had a baby, that's just how it goes. Like you're just gonna leak. But oh, you have a cute baby. Like it makes
You're gonna
anatomical
leak, but you have a cute baby.
yeah. It makes sense for you to leak postpartum. It does. Even if you had a belly birth, it makes sense. There's a lot of pressure, but it like doesn't have to stay like that forever. I stood up after my birth and just peed everywhere, and I was like, "Yeah, that tracks." Like Aaron,
Right.
like my husband, were like, "Yeah," like that was a lot. That was a little tiring. My body's not ready to hold that in right now, and then now I don't. Right, so like there are people, including myself, that help you get through this. So if you are preparing for birth with some of these issues, we can already help you during pregnancy. If you don't have any issues, fantastic. Let's make sure that continues, or let's make sure that your body can handle all the changes that happen during pregnancy. Just the straight up like growth of your belly, the changes in your hormones, which affects all the laxity or creates more laxity in your system. And when that happens, when the ligaments and tendons become more lax, we usually have to rely more on our muscles. So as physical therapists, any physical therapist, that's our jam is muscles, joints, all that kind of stuff, exercise. Pelvic floor physical therapists, we then add the pelvic floor strengthening into the regular outside body strengthening. So we're working on both parts of your body. Your outside body, meaning like you're going to do squats here, or you're going to do like arm exercises, but we're also going to keep your pelvic floor in mind. Are you doing an efficient and an effective push up? Or are you actually unknowingly like bearing down when you don't need to be? You can use that for if you're going to have a vaginal birth, but like you shouldn't just be bearing down throughout your life because that's a lot of extra pressure if you're pregnant on top of already the pressure of the baby. Or if you're postpartum, that's a lot of pressure already on top of, oh, your body just went through a lot and there's pressure just from that, right? From being open and being giving of this like human life.
Well, I know that a lot of my families are nervous about going to pelvic floor therapy because of the internal
Mhm.
exam. Like that's just a, oh, what if? And they also don't understand like what do I so it's an hour consultation. What and I know you can just speak for your business and not everybody in the all America, this is how we do it.
Yeah.
But what do they get in that consultation and when would you suggest doing internal, when would you not? And obviously Lauren is amazing with consent, y'all, so that's always a thing, but just tell us kind of what they would expect at a pelvic floor assessment and the first session, what we're looking for.
Yeah, during pregnancy, right?
Just pregnancy, yeah.
So, we have, like, a program here that starts at 20 weeks pregnant, but, like, you can come whenever. That's just when it starts because that's when I have tended in the past 12 years, have tended to see when people start to feel things moving and changing. But, of course, you can feel it before, especially if it's, like, 2nd or 3rd. Anyway, so, yeah, I can only speak for my place because we are out of network, which means we're a direct pay, cash pay clinic. So you just pay us directly. We don't contract with insurance. So we are able, that being said, we're able to be with you for an hour. Sometimes when you go to in network places, they can't afford basically to have you with them for an hour. Um, so you're here for an hour. You come in. I'm in one of our private treatment rooms right now. We have a bigger like area out there with like gym stuff. That's where my husband's working right now. I just like to call it like an outside body and an inside body assessment. So the outside body assessment is, your alignment. We're checking all of that, your pelvic alignment, your rotation, your shoulders, your feet, your hips, all of that. We
So are
watch
you
how you walk,
feeling the body when you're doing that?
hands on for sure. Of course, if you're comfortable with that. We also have great eyeballs, right? Which like we part of maybe the reason Aaron and I got together. We went to PT school and we just stared at each other's bodies for
Right.
2.5
Just
years.
saying.
We're really good at it. So it is helpful for sure to have our hands on if you're comfortable with that. But hands on, like checking your, placement of things, checking your belly, maybe touching your belly, seeing how the soft tissues are mobile or not mobile within your body, checking your hip range. You can't see me, but hip range of motion and neck range of motion. And then checking your strength of these, like checking your neck strength, because one of the common things when you're pregnant and then postpartum is we do go like this. Like, I mean, everyone does this, but it's even more so when you're pregnant because of the counterbalance that has to happen. And so we're checking your strength on that. We're checking your glute strength and your calf strength. Whatever we see in your functional assessment. Functional assessment means us watching you do walking, squatting, lunging, picking something up off the ground, whatever, you're complaining about. If you don't have anything to complain about, we'll just come up with things that we want to see that give us an idea of how your body moves. So we look at it and then we touch it and feel how it moves, feel for the soft tissue restrictions or joint restrictions if anything is really tight there, fascial restrictions or neural dural tension restrictions. And then
So I don't know what neural dural is.
um,
I tracked on that, but the neural dural, I don't.
neural dural quickly is like there's like a fascial sheath around your spinal cord
Mhm.
that then tracks down to all of the nerves that go out into your body. So basically, your whole nervous system is one system. The neural dural part is the sheath that goes around it to protect it. So
Got it.
one common thing I see in pregnant people is that like sciatic pain will be because of some neural dural tension, not necessarily because the sciatic nerve is pinched, but that it's actually overly stretched. So going down the rabbit hole,
Felt
but
that in pregnancy. It's not
yeah.
fun. Yeah.
Yeah,
Okay.
and because all often you're, like, sitting rounded or with your legs stuck out on the coffee table, right? So that's pulling that neurodural tissue versus I think a lot of like I said, a lot of people think of, like, nerves being pinched, and that's the complete opposite. So anyway, ugh, sorry,
Okay. A
rabbit
little
hole.
more information. That's good. Okay. So that's
So
the outer
so
body.
yeah, the outside body and then inside body, internal assessment is in our private treatment room. This is of the pelvic floor. And I say internal, but it can be done externally as well. I'll explain external. I'll do external now. Like, let's say you're wearing yoga pants and I want to test the tone of your pelvic floor. So, like, just like this, are your muscles really tight or do they feel nice and supple? I want to know that about your pelvic floor too, because overly tight pelvic floor muscles are rendered weak. And then overly, I'll just say it, even though I hate saying it, overly quote unquote loose pelvic floor muscles can also be rendered weak. They aren't always, though. They might just be like that. And then if you ask to contract it, it'll contract up. But an overly tight pelvic floor muscle, if you ask to contract it, it can't because it already is. So it's kind of like better ish to be this person. So you have some versus this one, because then we have to do two things. We have to relax the muscles first by way of pelvic floor like massage, but also changing whatever reason caused the tightness in the first place. Maybe it was because that walk or that squat that we watched you do was a little bit funky and you were using not an efficient number of muscles or whatever. So that's external. So you're like wearing yoga pants. You could like lay on the table here and we would feel just on the outside. Right here's your butt bone. And I could feel touch here, right, to get an understanding of what these pelvic floor muscles feel like. I can't really assess what the inside layer muscle feels like because it's a little harder to like push into there, but I can definitely feel if you can do a pelvic floor contraction, a push up or not. I can tell if you, when you breathe, is there mobility in it or not. So if you do opt for the internal assessment, then the internal assessment is glove, lube, one finger on the treatment table here. You're laying down and we just enter a finger here. And then that way we can feel these muscles and also the deeper muscles.
So you're
Um,
not like going back to the cervix. You're feeling vaginal wall
my intent, yeah, I mean, I can feel some people's cervix, but
because it's
during
right there winking
pregnancy,
at you.
yeah, during pregnancy, I avoid the cervix for sure. And we're going around it. Um, and feeling again for the tone. Are they really too tight or what? And then feeling for the strength. Can you squeeze my finger? And feeling left versus right. And then also tailbone position, but we usually just do that externally. Or if your tailbone is a big issue for you, we can assess the tailbone most effectively rectanally. So we would enter through the anus to feel the tailbone here. Because like you were saying, if you had an injury during shear and your tailbone's crooked and it's kind of like stuck underneath, but you're planning a vaginal delivery and that baby's got to come out,
Right.
we might need to move that thing or help you move it. Or if you can see it here, it's attached to all these pelvic floor muscles. So if this is like, curled underneath and then also like crooked, then that's going to make your pelvic floor muscles go like and be crooked. And we don't want crooked usually, unless you're crooked and fine. So in physical therapy, there's my clap. In physical therapy, we are primarily focused on your function. So if you're all crooked, but you can function well, if you're a pregnant person and you're all crooked, but you can breathe in and relax your pelvic floor and it stretches and then breathe out and you can do a push up, aka Kegel, and it's all moving and grooving, I'm leaving your ass crooked. Like
Then we're good.
we
Right.
don't
Why
get
why mess with something that's working right now?
totally. But if it doesn't work, then we're gonna go to, oh, okay, well, this is crooked. Maybe let's put you back on kilter here and retrain these muscles to do something different because they've been doing the same thing for however many years of your life, right? So if that way just now doesn't work for you, we're going to get you back in line, retrain those muscles to do something different so you actually make the change instead of just get you back in line. Okay, go back to your regular life, right? Get you back in line, go back to your notes, get you back in line, retrain so you act differently, move differently, and now you stay level.
Well, and one of the things that I know we like as educators, when we have practitioners in our community that know what we teach, know all of this expertise because they teach us, so therefore we can share it with you. It's a different kind of partnership because we're both educating for birth. Like literally every time we're working with practitioners, chiropractors, acupuncturists, pelvic floor therapists, not the exception to that. What are the most important things to prepare for birth? Because I know there's some overlap with fears, worries, tearing, all of that kind of
Yeah.
stuff. What are you working on when it comes to they might not have even gone to childbirth ed, but I think I should go check my pelvic floor out. What are you working with that?
My main goal is actually just to get people in tune, in touch with their bodies. Like, just be able to feel if they are clenching all the time, to feel if they're a little bit crooked or shifted. Because the thing with the pelvic floor as well is like that's an area that a lot of people don't talk about, or it's like taboo to talk about. On top, yeah, so don't talk about, or on top of that, taboo. So like you just are like feel really guilty about talking about it. So even
Which is
just
so weird.
so weird. But that's where we are.
Yeah,
Uh
because it's around the clitoris, and we can't talk about pleasure, and we can't talk about vulvas, and everybody thinks the vulva is a vagina half the time, like, that's not even the right vocabulary.
right vocabulary. Yeah, it's
Yeah.
where like yucky periods come out of. Yet everybody loves the vagina. So anyway, I think that's like one of my main goals in whatever we're doing is having someone understand and have ownership of whatever the thing is. So some people are like, "Oh, I was really careful about doing my moves in yoga." And I try to change that verbiage. I was aware and I was educated in the moves I was doing
Mm.
in yoga, not from a place of fear, but because, oh, I know that when I do that one move, it like kind of throws me out of whack a little bit and then my SI hurts or something. So I'm not going to be careful going into it. I'm just going to know and use this other muscle that I realized Lauren helped me realize I was not using very
I
well.
love I love the difference in language between careful and awareness because it
Yeah.
partially is helping break up shame.
Yeah. Yeah, it's like my pet peeve when people are like, "Oh, you'd be so proud of me. I, like, didn't do this thing," or, like, "I was really careful," and I'm like, "No!" Like, I want you to try it. There are certain things I'm like, "Alright, that was wild. Don't do that right now." Like, for sure.
Right, slow
But
down.
so I guess that's another thing, during birth of, like, learning not what you can and can't do, but what it feels like for you and when you do it. So, you're pregnant, you shouldn't do a plank. Well, I don't know, could you do a plank? Let's try and let's see. Does that affect your diastasis? Diastasis recti is where those muscles, your abdominal muscles, like kind of separate a little bit. Is it bad for your diastasis or is it actually helpful for your diastasis? Let's try it out. So that's another thing I think that I really try to implement too is like try with the intention and the knowledge. Don't just go willy nilly into something, but you have to learn that. And a lot of people don't know that, right? So learning the connection to their pelvic floor. So during birth prep, one of the important things that we do is learning the difference and how to do a full push up, aka Kegel, and how to let it down back to rest, and then how to bear down and lengthen it. Because that's if you're going for vaginal delivery, this is what's going to happen. Your pelvic floor does not push the baby out. So I actually don't care if your pelvic floor is strong for birth. It's nice for it to be strong for other things because it has to hold this baby for 10 months. But if we're just talking about getting it out, that's not the goal. It has to be able to relax, get out the way, lengthen as your uterus and you too are pushing the baby out.
And I think that's the one reason that the Kegel thing bothers me so much. Do 100 Kegels a day. I'm like, are you doing them right? Do you
Yeah.
understand the function behind it and the lengthening on the
Yeah.
release?
Are
They
you doing
don't
the other
understand
half?
that.
Yeah, the
Yeah.
other half or the other third, I guess, the other two-thirds of it, the relax back down and the lengthen part. Yeah. So I mean, I do prescribe Kegels, right, or push-ups, but not like
Not
many
the
other
ones we learn in
places.
class.
Yeah,
That's
not
why I
just
don't teach them in class. I'm like, no, go to a professional for those.
yeah, yeah. Or maybe you don't, because maybe you're someone has a really tight pelvic floor, so then I would tell you do not do them, and we're working on just the downward motion of it. The other thing during birth is like learning your breath patterns and how they affect your body.
Oh my
So
gosh, that is Lauren, when you've taught that coupled with regular breathing they're learning in birth class, I hear that about their pushing. I felt this and I knew what was going on here. And I know that what the midwife was telling me, but I knew different because they're connected with their body.
yeah,
And when they're using their breath along with what visuals they've gotten from you and the practice, it's a whole other pushing game because
yeah,
they're not stuck on their back doing what everyone's telling them to do because they can feel inside like, oh no, that baby's on this side. And they're rotating their body in a different way and using their breath.
yeah.
It's absolutely so different when they understand all the things that are actually happening in that pelvic floor area.
I like that you said when they know different. It's not no better, right? Because there are different breaths and different pushes for different reasons.
Yep.
What we go over usually, and what you taught me was breathing the poop out. Right. So like learning how to time that coordination of exhaling as you're allowing something to fall out of you, poop,
It's the
or
allow, man. The allow. It's not force and shove.
Mhm, or if you do need to encourage it, can you quote unquote push, right? But I like to use the word encourage. I think of like, hey, come on.
We're nudging you now.
We're nudging you, not this, right? Because that's gonna like if we're talking about poop, it's just gonna cut it off and there's the end of it. For the rest of it didn't come out. But learning to coordinate that exhale with the little bit of pressure if you are trying to assist that poop out. That breath pattern is huge to get for birth, and it is exactly opposite from what you need to do when you're doing exercise. So if you are trying to manage your big growing belly and you're an exerciser, or you're not even an exerciser, but you just got to do something that you have to pick up another kid or whatever, you want to turn your core on, right? And ideally, you turn your core on the exhale while you're pulling your core in. And most people inhale and pull their core or their belly in. And that's just, it is a way. It's not the most effective way, I don't think, for if you're trying to like brace your core to do some core exercises or to do pick up a water bottle or a case of waters, whatever. But that's completely opposite, right? You're exhaling and you're turning on your core, pulling it in.
But
That's
if
not what
you
you're
can
gonna do.
practice that and get that for birth, it's a game changer for pushing.
It's a game
And
changer.
that's
Yeah.
and it's a question that everybody always says, "How am I gonna push effectively?" And I'm like, "Well, pair it up with your pelvic floor therapist and it's gonna work really well."
Yeah. And if you're someone who's up for like an internal assessment, we can literally do that with you with a finger in there and you're bearing down or you're exhaling and you're pushing. And we can tell you if we feel an opening and a downward pressure and an opening of the pelvic floor and vagina, basically, or even cue you into that a lot of times if you're someone that has like a tight pelvic floor. We're like, okay, here, you can focus it here or here. Yeah. That's really cool to be able to like do different things with your body.
And if for some reason they had a previous injury or whatever and they were super tight on one side, that's part of the assessment as they're practicing, to lengthen and strengthen through pregnancy. If it comes to push time, they're gonna know not to lay on that certain side, right? Because we know so much about anatomy now with our
Mhm.
bodies and understanding skeletons, and women have taken a role in what our bodies do and how we're pushing and all of that. So we have such a broader view of don't put me on my back with my feet in stirrups and then couple that with my personal body is different than everybody's. This'll work. Like,
Yeah.
we don't if we know that ahead of time, we're gonna push differently. Like, nobody thinks, "If you put your knees together, how is that gonna open up the outlet?" That makes no sense. I'm like, "Have you done it with a skeleton?" It actually does, you know? But we're putting those pieces together now, so it's that can make the difference in getting a baby out of your body and having a cesarean.
Yeah.
If you know your anatomy, understand it, you've practiced, it literally that's why I'm like, on Instagram, I could filter a whole little list out for you that childbirth educators and PTs have put together of this is actually how your body works. How come that full squat works when it doesn't work when I'm on my back? Like it's
Or just
crazy.
gravity, right?
Yeah,
We
it's
all know
crazy
about
how much we know now.
yeah, and in our, like, pregnancy sessions, we go over, pushing and breathing practice, but we also go through, like, a bunch of different positions, and just see which ones are most comfortable for you, see which ones you can actually push and bear down in, and we just practice. Now that might change by the time, things happen during birth and you might not want to be squatting with one knee up, but at least you know ahead of time, oh, my left hip is tight. I'm probably not going to want to squat down with my left knee all bunched up here because I don't want to deal with that tightness that occurs, right? So we go through, yeah, a bunch of different positions, which is influenced by like the birth world work that I like learned, right? So like putting the two worlds together, they have to go together.
What I think is the most beautiful part about understanding your pelvic floor, having the training with a pelvic floor therapist before, your confidence level is so different when you go into that birth room. Whether you have medication or not, you are so connected to your pelvic floor and your body. You also, if you're 10 centimeters, you can cut your epidural. Just so everybody knows that. You can literally cut your epidural, get all the feeling back, and then be upright and moving with gravity and stuff like that. And I'm applying what you've learned in pelvic floor therapy or from your PT or understanding your body and that you do need your right knee up a little bit more. And that's what's going to open everything up differently.
Mhm.
You can still do that. Also cutting down the risk of a cesarean because you're on your back and it's not working.
Yeah.
So the confidence level is so different when
I call
you
it
have
when you've
connected.
been through it. I call it body literacy. It's part of what we do when we do like vulva mapping. So you just actually even know the words of your parts. But then there's also that's just words, right? But then there's body literacy of like, what does that feel like in it? I remember during my birth, I had to get into like a little runner's lunge. And this is wild that I even thought this and I'm kind of embarrassed about it. And I was like, oh, yeah, I don't have that range of motion. mid, mid everything, right? Like he was coming. And I was like, oh yeah, yeah, that's really tight. I should have worked on
But isn't that funny that your PT mind kicked in right at that
that.
time where I would be like, oh, that hurts. And you're like, oh, range of motion, blah, 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 blah.
Because other than that, I was thinking nothing. There were no thoughts happening, but it was just like, boom, leg was up there. And I was like, oh, yes, I don't have that range. I don't have that range was in my brain. Just
That
when,
is so funny.
whoa, working on hip mobility.
And probably every other person that came through your office, you were like, "Oh, mental note, we're gonna make sure that you can do Captain Morgan pose for birth
Just in
just in
case,
case." Oh, that's so
For sure.
funny. I I would like you to discuss this because I have the same thing kind of in birth class. The vulnerability of, am I sharing too much information? Am I not sharing enough?
Mhm.
How do I get the point across of what really needs to happen here and why? Because a lot of times we get a ton of resistance.
Yeah.
Well, that's not gonna work. Well, that's not gonna work. I'm like, "But you came to me for help. You asked me this question. Like, I know you don't wanna hear it, and I don't wanna scare you, but I wanna give you." How do you deal with that during pelvic floor? Because once again, we are dealing with a body area that is full of shame. We don't understand pleasure a lot of times. We haven't been connected to sex. There's a lot that goes on there. So how do you handle that as a pelvic floor therapist when you get information you need to deliver, and how do you do it?
I'm the same with you as far as like I feel like I read people very well because I allow them to talk more than I talk. Um or I guess ew, I allow them to, but like I want them to. Right. So I just start with that first of like, what do you think is going on? What are your questions? What do you have? Instead of just like, here are all the things. I want to tell them everything. Of course, I want to tell them everything from studying, from personal experience. I want that. But I think it's just more in the way I spew the information. I don't use any fear. I fucking hate fear. Like, what's the point of putting fear in someone? We had a birth prep class a couple months ago, and I was like, just finding a way to not be fearful of birth, I think is the most direct way to not experience as much pain. I know this is not what you were asking me, but it just made me
No,
think.
it's exactly, you're so right, 100%.
Like, because I distinctly remember being telling Aaron, because I didn't want him to worry. I was like, I just want you to know I'm not, this isn't registering to me as pain. I've only had one baby. I don't know if we have another one, if I would say the same, but figuring that thing out, like, where does the fear come from? I just didn't know to be fearful because that's not what I know. That's not what my Instagram feed is. My Instagram feed is just babies just, coming out and it's roaring, but that's not pain. So back to your question is just like, I think I wait for the questions to come in, or I might like poke a little bit of, um, I do have a lot of people that come in and want to do like perineal massage. And the newest research is that like rough perineal massage is not good and leads to micro tears, and then you tearing more likely tearing. But when that's already in someone's mind, I'm not going to shame them for thinking ahead. That makes sense to want to stretch things out before something big comes. That totally makes sense. So we talk about it and we say, oh, we can totally do this. Like, I like to do some perineal massage for that connection factor and for like not desensitization, but sensitization towards touch
Right.
at the vulva and the vaginal opening that is not what you're used to.
And there will be a head that takes up all that room,
Hold space.
and the skin will be at max capacity, right?
Mhm. Yeah. But I think instead of bringing that up or instead of saying, "Oh, no, 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 don't do that. That's gonna make you tear," taking that information from them, noticing that they are interested in this. Why I'm not gonna yuck their yum. I'm
Mhm.
gonna tell them the research on it and then say, "This is what we can do."
Well, and we also have research that when you're in a full squat, you tear less because there's less hands there,
Yeah. Just hands off, maybe like a little warm compress, right? That was the other thing that could be
right?
helpful. But otherwise, just like freaking leave it alone.
Yeah, midwives have less of that issue because they are hands off and they're going with the lead of your body.
Mhm.
So it is different. And I always kind of go, yeah, we could totally get the machines and all the plastic inserts and do all of that. Do you think they're doing that in jungles around the world? In countries that have no access to care, do you think no, but are babies still coming out of their bodies? Yes. And have they been coming out since the beginning of time? Yes.
Because they also
Sometimes less is more.
yeah, it's not looked at as a big scary thing and as a natural thing that your body can do. Like, it can. It just can do it. Like, there are exceptions, of course, but man, yes, so I don't know, did I answer your question, Care?
Yeah.
Man.
Yeah, absolutely. Because you're right. I mean, we do have a lot of information and it's hard to be like, and this and that. But I've always liked that approach when with sending people over to you guys because you're delving into what the psyche is saying. If
Mhm.
they're there fully for fear, I can't tear, like, it's impossible for us to prevent that.
Yeah.
Like, your baby we could do all the things and your baby could go, "I'm coming out this way now," and just switch.
Yep.
Like, we can do so much, and then so we it's the layers of fear you have to work through and realistic expectations.
Mhm.
Like, just because you go to pelvic floor therapy doesn't mean you're not gonna pee your pants,
Yeah.
you
No,
know?
like, I'm a pelvic floor physical therapist, I just sure did.
She just peed herself right when she stood
It
up after having a baby, so
there it was.
there is no, that. And
Yeah.
there is a lot of internal damage that can be done when we are coached, pushed for long amounts of time before our baby had dropped down to where we could be pushing. Our body is taking that baby with that contracted uterus and putting them in the place where
Mhm.
it's going to trigger our push response and move baby down. And baby's now at 0, 1, 2, +2 to get out rather than we're starting to push at -3.
Yeah.
There is a lot of pressure on the bladder and all those things that's a lot of stuff that could have just been like, let's just relax for a little bit and let the
Yeah.
body do some work and trust our baby and get upright and move or use a peanut ball if we're in a bed, stuff like that to
Yeah.
assist our bodies without overdoing because
'Cause it's not
there's
necessary.
no, and there's a lot of lack of patience when
And
it
it
comes
yeah.
to pushing, getting babies out, timelines, all that kind of stuff. And I feel like when we are connected to our bodies and our pelvic floors and our sense of autonomy to say, that doesn't feel good to me. I'm going to try this or do this. It's a game changer. It's so different. And we have different outcomes because of it.
Yeah. I was gonna say when you don't know what things feel like, right? Of course, if you've never been through labor and birth before, you don't know what that feels like. But just if your mind and body are not connected, then you're gonna let someone else tell you what to do with it, right? Because you don't know. How would you know? Like these people are smart people. I'm talking about like, doctors or something, right? Like they are very smart, of course. So why wouldn't you listen to them? But they're not inside of your body. And so I just think learning, at least it can't do any harm, right? To learn what things feel like in your body and like, do you want to move this way? If you're offline, you're not gonna know to move that way. Or if your hip was tight, forgot to work on that hip, and go to move that way, but it was really really tight. It maybe could have been better. Like I just yeah, that connection to your own body. That's just like I'm repeating what you said, and you can speak up and you can do and move for what you want or what the baby wants versus I don't know. Like so taking a dance class. If you don't ever take physical therapy, for physical therapy, or you don't ever take a birth class, right? Maybe take a dance class, like a belly dancing class or like a little burlesque class. And I'm biased, I'm a dancer. But I think it helps you feel into your body, right? You can feel into your body in yoga too, right? But it's a little less movie groovy.
Well, that actually puts us right into the pleasure mode, which is where I was gonna go next.
Was it my moves that got you?
Because your moves, yeah. You said burlesque, and I'm like, "On. Okay, I love burlesque." Not for myself. We've already talked about why I stay out of dance. There's just too many things I have to do.
Yeah, too
Yeah.
many barriers, yeah.
I wanna talk a little bit more about pleasure in
Mhm.
that when we're pregnant, we're not really having a lot of sex. I mean, some of us are, but towards the end, we're tired, we're a little larger, it's hot, etcetera. But,
What space?
um, those parts, right, are still moving,
Mhm.
and that's why, especially if you're a survivor, be in pelvic floor therapy ahead of time because all of this is connecting and it's gonna go into postpartum. When I have Lauren back, we're gonna do another postpartum, episode. But can you talk about what are we not wanting to lose as far as pleasure, mobility, thought process while we're pregnant? Because we
Yeah.
are also extra tired and our brain is starting to shut down because we're fully making a baby.
Yeah.
But what do you talk to about pleasure with your clients?
Yeah, during pregnancy, just like you said, yeah, it can be hard because your biggest sex organ is your brain, and that's from Dr. Emily Nagoski in this book. There's a stack of them right here called "Come as You Are." I love it.
Good
Uh,
book. Come as you are. Very good book.
yeah, when you're pregnant, your brain is elsewhere, right? But this is also just regular life because we all just have lives outside of having sex, right? So if your brain is not into it, it's hard to get down and feel juicy and gooey and like ready to have sex. So just first is like don't feel hard on yourself because it's not just like, oh, I have no sex drive. It's now your brain is like preparing for this child and oh, I'm sick and oh, my back and like oh, my core, like all these things, right?
And at the
So
same time, we still have to connect with our partner because if we've stopped it, then I talk about this in class. We stop in the first trimester because we're tired, our boobs hurt, we can't even function. Second, we're preparing for baby showers, getting work wrapped up, whatever. Even though we're a little more frisky, we might be doing it, but maybe not. So we're still pushing our partner away.
yeah.
And then third trimester with the weight and the heat and all of that, your partner, whether male or female, does not matter, feels
Yeah.
pushed away and replaced quickly.
Yeah. So, talking about pleasure is realizing the word pleasure, though, like leading with pleasure. Pleasure does not have to be genital. Pleasure does not have to be P and V or anything in V or whatever. It can be, but also sometimes there's like a hormone fluctuation. So, like the vagina and vulva might not be feeling so hot because the tissues can change, right? So, really focusing, and this is like your opportunity then now to explore of like, oh, what actually is pleasurable? Do I just really love a good head rub? Like, I get my head rubbed every night. Just thanks, babe. Um, like, what is actually pleasurable? If we are talking genital pleasure and you're up for that, I do wanna tell you a little bit about the anatomy of pleasure in the genitalia because back to the clitoris, um, you're gonna have the most success, meaning the most feel the best and have maybe, like, no pain or less pain and enjoy the most if this clitoris is fully engorged. So
So
the
who's got an
clitoris
extra 45 minutes? Because
yeah. She talks about it a
Mm.
lot in the Come As You Are book. Remember, it's here. It straddles the vaginal canal. It takes 45 minutes for this little lady to get fully engorged. Now, that doesn't mean they gotta go down on you for 45 minutes, or that could be your thing, whatever. It could also mean that you're, like, flirting throughout the day, whatever's gonna, like, make you excited. I can't remember if it was in her book or something else that I listened to, but it was like, remember when you were dating and you had, like, you only saw them on Saturday, so you had, like, all week for your clitoris to get engorged, and then you're like, "Ah!" That kind of those kind of vibes, right? And what this physically does is it puffs up, right? And then it's like bumpers, like 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 bumper cars. So it's just more fluffy. Lubrication can change too during pregnancy and postpartum. So just slap on the lube, and also maybe think of a vulva moisturizer. Anyway, but it just makes things more pleasurable, but also more fluffy. You can handle more. Gosh, that sounds bad, but you know what I mean? Um, if think about it like a penis. You would not use a flaccid penis. You could try, but you can't really, shove it in there very well.
I mean,
Unfor
and the flaccid penis can still have pleasure without being used the normal way.
100%,
So there's that.
100%. Good, yes, thank you, Care.
Yeah, I
The
there's a little soft cock week that one of my friends runs, so that
Ooh.
I've learned a lot from that, actually. She's really good
Yeah?
at what she does.
Um, but so, we I feel like we understand the how, like, functionality works, like, of a penis, right? Like, typical function can it's the same thing for a clitoris. So we would like it ideally to be engorged for maximum pleasure if you're having penetration.
I think one thing to remember while we're pregnant is pleasure can be, "Oh my gosh, you did the dishes." Pleasure can be a picnic and reminiscing. The purpose of pleasure in pregnancy for me as an educator is what I want you to go for pleasure is because the oxytocin is what's governing your labor. The melatonin, your circadian rhythms, like all those hormones are what is getting your body prepped and ready for labor, and it's actually starting labor. So if you're in fight or flight and angry and stressed out and all of those things all the time, you're postponing what could be a moving forward train, right? Will you get there? Absolutely. But I would much rather you get there in joy and comfort and loving things, even if you're miserable physically. The head rub, the foot rub, the hand rub, good conversations, the reminiscing, you guys, of how you met and those fun things, and even how you're going to prepare for baby and what places you're going to take them and your favorite place in nature and all of those things. We're going to, go to the monkey beach in Thailand and whatever it is that you're
Yeah.
building that oxytocin reserve because all of that is going to help you through labor and especially your partner who's reading all of those pheromones and hormones on a subconscious and a base level, all of that is a triggering as you're pouring them out during labor.
Mm,
So, yeah,
that's so good, Care.
it's so sexy.
That makes me think of my therapist. What she taught me to work on was, like, focusing on how, like, in specific, how the sun feels on my skin, and, like, maybe the wind then added to that sun, and, like, that's a fucking amazing feeling, but that's just, like, our life, especially in San Diego, right? Like, that's just, like, you just walk to your car and that happens. But I never, like, dropped down to be like, "Oh, that's so good." Like, just have a
Right.
little pleasure moment. And that also just it also helps drop into the whole, like, connecting to your body. That was a place that I was not connecting to my body, right? Like, I just like, "Oh, there's sun and wind." But now I'm like, "Yes, sun and wind, let's
Wow. Thank your
go."
therapist because that is I'm excited about that. And think about it, even if you're cold and you're in Georgia right now with snow, which is random, you can still be outside in the sun with the crispness
Mhm.
of the wind on your skin.
Yeah.
Like,
Yeah, there's so much to be found, I guess, or, like, noticed that, personally speaking, I wasn't noticing, and even though I teach these things to
yeah,
my kids.
that's why we teach. Thank you so much for being here today, Lauren. We are going to bring you back for sure for postpartum. Is there anything else you want to leave our listeners with, like one last piece of advice or anything like that? I am going to include where Lauren is, where you can find her, especially if you are local. What's one last thing you'd want to say to anybody?
During pregnancy, remember that it's not about a strong pelvic floor. It's about a flexible pelvic floor. It's not about a tight pussy. It's about a flexible and mobile one. That's for all of life, whether you're pregnant or not. I think that's it. And then just, clitoral engorgement just saves lives,
Right.
at all
One
costs.
orgasm at a time.
One
That's what we're here for.
however you get there, whatever. Yeah, I just think we'd all be a happier place if we had more engorged clitorises.
We absolutely would, and break some shame down about what our bodies do, don't do, and are capable of,
Mhm.
and accepting what they do, and how to encourage even more of what we love.
Yep.
Awesome. All right. We will see everybody next week. Thank you for joining us for February.
Thanks for having us.
See you next week. Thanks for joining us today. And remember, it's your body, your choice, and finding your voice is your power. Be sure to subscribe to our YouTube channel, follow us in all the places, and go to birtheducationcenter.com for our blog and more online education classes. And we'll see you next week.